This is SSN.
Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. In the last episode, we spoke to Dr. Eugene Maida about osteoarthritis and its connection to chronic pain. Dr. Maida talked about the different methods to help people living with OA. So if you missed this episode, you can listen to it on Spotify or our Apple feed. There's a lot of information on the web, and there are many podcasts out there on how proper exercise is important for our health. Strength training helps maintain muscle mass, helps with balance, mobility, and longevity. However, when someone suffers from chronic pain, how does that person do strength training in a safe manner? To help us understand the proper way to strength train when you're suffering from chronic pain, I'm joined by Leroy Ho, who is a physiotherapist in Vancouver and works with chronic pain patients. Leroy, welcome to the show.
Hi, Tom. Great to be here.
Excellent to have you on the show. So, Leroy, we've talked offline a little bit about chronic pain and especially with veterans and I guess anybody suffering with chronic pain and some of the challenges that they face. But maybe we can just start our discussion. I know you've been working with chronic pain patients for a long time. What are some of the challenges that they face?
Well, they face a lot of challenges. And so I think the most prominent thing for me is that they often go through this negative cycle of pain. And so let's just say that an injury has happened many, many years ago. They were involved in some accident, or there was an injury that either was addressed, but they weren't fully recovered. And so then this persistent chronic pain can happen. Potentially central sensitization can start to manifest as well. And so because of all these factors, they are generally living more of a sedentary lifestyle. They have a decreased physical activity. And then because of that, they're in more pain. And so you can see that it's just this negative feedback loop that happens.
So as a physiotherapist, is there, if I'm a chronic pain patient and can I just go to any physiotherapist, or is there a difference working with chronic pain patients versus working at another clinic that doesn't deal with chronic pain patients?
Well, as a physio, I'd like to think that, if you go see any physio, they would have the expertise and the experience to see anybody with any type of condition. I think for the people in chronic pain, it's slightly different. And when we want to define chronic pain, we could have the musculoskeletal pain where it's, you've had this knee injury for a very long time, you're a runner. And so the difference is quite drastic compared to somebody that has had persistent pain, and they may have widespread pain. They may have not only low back pain and knee pain, but they may be more sensitive to the light and the sound, and they may be more fatigued. So I think it's really important that the physio or whoever you're seeing has experience in chronic pain, because so oftentimes I see people, have an exercise program, but not saying that the exercise is bad, but it's just probably not the right choice of exercise, not the right dosage of exercise. And it doesn't really address the other elements of chronic pain apart from building strength and muscle.
Yeah, and I think we heard that in our last podcast with Dr. Wright on safe movement about the differences with chronic pain and how the brain and the body are connected to chronic pain, which I guess makes it a challenge for you. So when you're looking at strength training, how do you move forward then if you have some of these challenges that chronic pain patients face? Like what are your steps? How would you, or do we need to step back a little bit and get into a deeper dive on what strength training is first?
Yeah, well, that's a very good question. I think, of course, our end goal is to get stronger. And as you said in the introduction, all those things are really important for longevity and living more of a disability-free life. But strength training is oftentimes not the first place that we want to go to. There's multiple steps before I feel comfortable at least giving somebody a strength training program. And I would say the first step really is to desensitize. There's a lot of, nuances and factors that go into this, but if I were to tell somebody to at least help them understand why we don't strength train first is using the cup analogy. So you have a cup, and unfortunately, people that have had chronic pain for many years, that water line is very high. So there's not a whole lot of buffer room between overfilling the cup. And if you think about what exercise does, exercise is a stress on the body to adapt some positive change. So that person that the water line is already so high up to the edge of the cup, there's not a whole lot of buffer room to add on to that. And so with exercise, that could cause a flare up. So what we want to really try is to scoop more water out of that cup, meaning to desensitize. And that's the first step that we use. And as a physio, and with an understanding of human movement, I think using gentle mobility drills is a very useful way to help somebody desensitize. There are many other ways. Pacing, for example, is one tool in the toolkit. But let's go with mobility, and say you can choose any type of mobility drill that you want. Let's just say low back, because it's generally the most common thing. Somebody may have pain bending forwards or bending backwards, and so we want to start to desensitize that movement. We may start with a very simple mobility thing like a cat cow. And so, you're on hands and knees, you're trying to move your spine, bending it forwards, rounding it. And we don't do it in ranges where you're giving yourself pain. Okay. That's a little bit of a harder discussion, but oftentimes I see people try to move all the way to the end ranges. And every time you do that, you put yourself in more pain. And unfortunately, that continues to trigger the nervous system. It continues to sensitize the body. And it learns that every time I do this motion, I am in pain. And so we want to uncouple that. And so we do this by moving in ranges that are much smaller than people think, and maybe like 25% of what you think you can actually accomplish. And so here we're trying to gradually expose the body to more pain-free movement.
So I know when you're talking about the cup, and I guess for some listeners who don't understand that, that cup is basically what I can handle in my body. And if
Yes.
I'm
Yeah.
already at a certain level, now I start exercising and I'm doing it wrong. I'm just adding more stress to my body.
Hmm.
So when you're talking about decoupling, I mean, you talk about how that helps reduce, I guess, some of the centralization, nervous centralization issues. But when somebody's already suffering from pain, if you get someone like, I mean, we talked about this on one of our podcasts in the first season on military mindset, where it's just push, push, push. If you're getting a patient who, one, is suffering from pain, but two, also comes from a culture where it's pacing isn't even a word, and they're just pushing, how do you step them back so that you can decouple them so that you can move forward with that individual to start building strength?
Yeah, I would say guidance, and trying to impart, the education and the knowledge around pacing, for example. And let's just say we take a military population, for example. They have had a lot of guidance and a lot of structure within their day-to-day lives. And so that's really what we're trying to do with people in chronic pain as well, more in the civilian population, for example, is that, say there's a lot of booming and busting that happens. They feel great one day, and so they're able to accomplish more of their tasks that they've tried to do the previous days. And unfortunately, the next day, or potentially the weeks after, there's a flare up because they've done too much, and so now they're in more pain, and now they need to not do anything, or they feel like they don't want to do anything. And then there's just this cycle of boom and bust that continues to happen. And so what we're trying to do is to give them some structure, to say, okay, you can do your cat cow for 5 minutes at this level of intensity, and hopefully it won't flare up your pain. And when you do have a pain flare up, this is something that is still very useful to do. So it's to provide more structure and guidance. And I think that translates very well into more of the military population.
Yeah, I know we've seen some literature out of McMaster's where they've looked at military or veterans in a pain clinic, and they've done well in the process, and probably because of that structure that you're talking about. What I'm understanding you're saying is, first you start to decouple, and then, okay, so now once you've done that, where do we go from here? So you got a chronic pain patient that's suffering, and now you've kind of scaled them back. What's the next steps?
Before we get to the next step, so this is another part. It's like sometimes patients may think, okay, I'm ready for the next step. But then we say, okay, let's take a step back, because, there's no rush. We're not at a deadline for anything. This is a journey that we're going to take together. So let's just say there's another point of desensitizing, and that may be finding other ways to relax the body before we start to now build some physical tolerance. That's step two. That's kind of what's on the horizon. But we want to start to find ways and strategies to help people relax when a flare up may happen. So something like relaxation breathing, and Dr. Andrew Huberman on his podcast, he brings up a very useful breathing strategy. He calls it cyclic breathing, or a physiological sigh. And these are strategies for breathing. It is very simple. Tom, you can do it with me here. So it's like you're taking a breath in through your nose, You're trying to fill up your belly. You're taking another sip of air through your nose, and then you're exhaling through your mouth, very slow and calm and gentle. And you can do this anywhere, anytime. And the goal here is to help the nervous system calm and relax. I find a lot of people with back pain, for example, let's keep going with that example, is, it's really difficult for them to expand their torso and their core because they need to let go. There needs to be a level of calmness. Their muscles can't be so guarded and tight. And so we can start to find other ways in terms of movement, in terms of breathing to help desensitize the body further, because this will be a very useful point when we go to the next step and talk about building physical tolerance.
And I think that breath work is so important. I have seen that one with Huberman. We've also done one with Abby Manu, Sood, on our podcast as well. And so breath work seems to be something that can help calm that nervous system down. So those are so step one is decoupling and step two is relaxing. And now we're into the next one.
We're on to the part where we're not yet at strength training. We're gonna get there, but we are starting to build the physical tolerance. And I think I'd like to use that word because, are we building muscle? Not truly. We're not really stressing the body enough to do that. We could say that we're building endurance for the body, but I think just the tolerance to withstand more physical activity is best. So, like we talked about, we might have, had a lot of work in desensitizing the body and the nervous system. We've now provided some structure and guidance around pacing. We're preventing as much boom and busting that happens. And so now we have to find an exercise that can start to build some of the physical tolerance back up, because like I said before, a lot of these people in pain, they're just starting to now increase their physical activity. We want to do this at the right time. We want to select the right exercise for it. So we want to find an exercise. It could be any exercise. There is really no bad exercise. It just depends how we modify it for that person. If we were to go back to the example of the low back, we choose an exercise like the bird dog. Okay, a very classic exercise. You can Google it, find it everywhere. You're on hands and knees. The goal is to have opposite limbs, parallel to the ground. And so this stresses out those low back muscles. And let's just say, when we're working with somebody in clinic, sometimes just being in that start position on hands and knees is enough for that person. Sometimes that's too easy, and we start to now have very gentle progressions. We may raise an arm and hold it for 5 seconds. We may find that that's too easy as well, and we may start with both arms and legs to do it at the same time. But the goal of this is to now build that physical tolerance back up. It doesn't need to be sweaty. It doesn't need to be intense. We just need to start to do something to now engage those muscles in a very structured and routine way. I think the nuance here, when we're comparing to more of the general population compared to the chronic pain population, is that there needs to be this structure of, we want to improve the endurance of these muscles. So let's say we aim for a range between 5 to 10 seconds. And that's the range that you go at. On a bad day, we might choose 5 seconds. On a really good day, we might do 10 seconds. But that range isn't massive. And we're sticking to the guidance. We're sticking to, a dosage that we've trialed and errored that seems appropriate for that person.
And when you say trial and error, is that on the individual or just from the experience of working with chronic pain patients? If we talk low back, I mean, that's the most common one that's out there, right? Is that just experience or a combination of both experience and the patient themselves?
It's a combination of both. And we want to be as patient-centered as possible. So we're always working with the patient in front of us. I always, especially people in chronic pain, there's often this what we call poor interoception. So the awareness of what you're feeling. A stretch may feel painful. The muscles being sore and burning, which is generally associated with good sensations when we're thinking about exercise training, that may also be interpreted as dangerous and threatening. And so it's up to us, as people that are more experienced, that have the knowledge to help guide patients to say, what are you feeling here? Is what you're doing safe? Is it effective? And we're just trying to find the right amount. Because if we say, for example, 10 seconds, and that person is way beyond their means, and we know that we're trying to push and progress, but that person just doesn't feel ready. They're not safe. They don't feel like they've been heard. And so these are some of the barriers that we have to help navigate, especially with somebody that's in chronic pain as well.
Instead of just the old of the training mentality of just push and push
Exactly.
and try to increase every week so much or every month so much. Yeah, okay,
Yeah.
that makes sense. When we talk about strength training too, I mean, we talked about muscle mass, and I mean that is something I think if we look at veterans, even an older civilian population as well too, the muscle loss, which of course impacts health and longevity, right? So how are you? Like, I understand you have to go through those steps to get somebody ready for that strength training. So how are you trying to maintain muscle? You've done the decoupling, you've done the relaxation, you've kind of started with no weights. How are you getting into the next stage to ensure the person maintains muscle or gains muscle? Because I would think that also supports the structure as well, right? Too, and lessens the chronic pain. Is that correct?
Yeah, and I would say the majority of our focus really is on building our function. So, more so, how many times you can get up from the chair? Are you able to walk up the stairs? Are you able to complete most of your daily tasks with, more ease, rather than solely focusing on the pain? Because that's what oftentimes can really convolute people, is that I'm always thinking about my pain. And if my pain isn't better, then I must not be better. But there's so many other things, is that when we're starting to build physical tolerance, we're saying you can do, now we've transitioned you from a bird dog into a sit to stand. So a much harder activity, something that is way more geared to building strength. So now that person can do 5, 6 squats, without the chair. They feel comfortable doing it, but they're still in the same amount of pain. But you look back on what they could have done a month, 2 months, 6 months ago, that they're still in the same amount of pain, but they can do more functionally. And that is a win. So that is a measure of success. And we have to get that kind of idea across rather than being so focused on pain, because our goal really is to provide exercises and strength training for these people. And if you think about the definition of strength, we want people to move multiple joints all at the same time. We want them to use their whole body to do some task that is generally quite physically exerting, and we're not doing this repetitively. Okay, so a very common example in the weight room is a squat. We're loading up the weight, we're doing 5 repetitions at most, we're taking our breaks. If we were to translate this into an everyday task, this happened, the previous week, is you go grocery shopping, you have a bunch of heavy stuff in that cart, and we have to lift it from that cart into the trunk. That is a feat of strength. That's not really an endurance work, but these are translatable skills that we're trying to now impart on somebody that has been sedentary for a very long time. So to go back to, how do we now structure our and guide people into this, is I think a big part in terms of chronic pain is flare up management. And so, inevitably people will go through flare ups, not because they want to, but just stuff happens externally, things that you can't control. The weather may change, for example, and that may already predispose people to a higher flare up stage. And so if we've built this physical tolerance through, level 1, level 2, level 3, and so forth, if they were to have a flare up, most likely they would go back to a baseline that is higher than what they first started with. Say they started at level 1, okay, and there's a flare up that happened, they go back to doing nothing, being very sedentary. But hopefully now, with some guidance, with some structure, with months of training and consistency, if they were to go through a flare up, they may go back to level 2, which is much higher, which is a much more functional spot than where they were before.
Yeah, so I mean, I guess that's one of the things I was thinking is, if someone's been sedentary for a long time and their pain is really impacting them, and I get that the education is a big component of this, and we've done that with our veterans too, where we've provided that education and insight to pain science and safe movement and all that. But the part of being motivated, self motivated, how do you get someone to be self motivated? And when I hear you talk, and I'm going to kind of answer part of my question, is getting them to see where they've progressed from before. I get that's one, but
Mhm.
when they leave the clinic and they only see you once or maybe twice a week, how are you getting them to be self-motivated after so much pain they've been through and so much sedentary lifestyle?
Tom, that is a very tough question.
That's
And
why I asked it.
that's why you ask it exactly. I think there's many people that you've had as guests on this podcast that do a very good job at, behavior change and motivational interviewing and trying to find the other areas in their life that, can help motivate them to be as physically active as possible. It's not, I would say every single person that I see is motivated. It's exactly why they're in clinic to see me and anyone else, is that they still have the hope and there's still the motivation. So I think continually being reassuring, continually being positive, trying to show them that these little wins, which maybe they don't interpret them as wins and success, they really are. And if we zoom out into the big scope of things, yeah, I'm sure people are moving forward. There may not be any less pain, but they're able to do more with their lives. They may have a higher quality of life. But when you zoom back in, it's often so difficult really to see the changes that happen. If you can see yourself every day, then it's really difficult to see the changes that happen in your own body. And that's why I think always having somebody accountable to, having somebody that understands and is experienced working with chronic pain, whether that's a physio or just a multidisciplinary team, your medical team that is trained in chronic pain, to have people to continue to encourage you and to push you further. I think that is a very useful thing for people to try to find.
Well, we're going to wrap up. And I just want to, you're someone who's worked with chronic pain patients for a while. You work in a chronic pain clinic. So takeaways
Yeah.
for your profession. If you were to, if I was a physiotherapist working at another clinic, give me 2 takeaways. And then also, as if I was a pain patient, 2 takeaways.
So let's start with the pain patient first. It's freshest in my mind. So, first and foremost, we have to find ways to desensitize. We go back to the cup analogy. How can we reduce the water in your cup? Whether that's through relaxation, whether that's through medical management, whether that's through nutrition, exercise, pacing. There's many tools that people have, and it's to use your best knowledge and your experience and your guidance to try and reduce that water in your cup. Okay, so you have more buffer room. The second thing then is to now build a bigger cup, is to now find the right ability and resources to help guide you to build more physical tolerance, to then have the potential to strength train, because that is, like I said, the end game here. And then in terms of, other people that may be listening that are in the health field, I don't know if I have 2 points exactly, but what I want to highlight here is that although the things that we talked about in this podcast are very structured, very organized, it's not that simple. It's never that easy. It's not as, easy as, follow these 3 easy steps and blah, blah, blah. Unfortunately, there will be a lot of flare-ups that happen. And I can tell you this, is that I work with people in chronic pain every day. And these are truly the most resilient people that I've met, both physically and mentally. And I think we need to play at those strengths. We need to continue to motivate them because they've had, possibly a very painful week, a very stressful day. And so they just deserve all the credit just for showing up and trying to improve. And I think as being as supportive as possible, that is one of the best gifts that you can give as a person working with people in chronic pain.
And that leads right into what I was thinking is self-compassion and celebrate the wins, no matter how small or big they are, right? I think that's key. Well, lots of great information. Thanks for being on the show. I think it's going to help a lot of people who are going to listen into this one.
I hope so.
Yeah, I think so. I think it, I always learn stuff on these, stuff. I learn a lot of information on this, talking to experts on this show. So for our next show, we're going to be talking with Rosemary Wilson from Queen's University on the research they are doing on a virtual self-management program for chronic pain. If you don't have access to a pain clinic or you have a hard time getting a referral, they're exploring other ways to help people in that. So that she'll be on our next show. And for feedback about this show or any other of the episodes or more information on chronic pain, you can visit our website at veteranschronicpain.ca or follow us on Facebook and Twitter at Chronic Pain COE and on Instagram at chronicpain_COE. Leroy, once again, thanks for being on the show.
Well, thanks for having me.
Yeah, it's great discussion. And for everybody else, stay safe and keep the hope alive.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network and Eye Contact Productions.